being asked. Mm-hmm. Perfect. We can do a screen share. If anyone can hear me, we're going to get started in about 5 more minutes at 6:15, and I'll begin. If anyone can hear me, we're going to get started in Once you've logged in, please go to the Q&A and submit ask a new question. And once you do that, put your name in there. Once and it'll populate on my screen. Please go to the Q&A. Okay, it looks good. I'm glad you guys can hear me. I can see your names populated as questions on my screen. Okay, it looks good. I'm glad you guys can hear me. I can see your names populated as questions on my screen. So we're gonna go ahead and get started. I hope you all are safe. There is a flood watch warning for a couple more hours, so stay indoors if you can and be safe. So as you know today, this is for everyone who has signed up to complete their research with the Cobb Research Lab. So we're very excited and we're very pleased, and we are looking forward to working together to generate a great product. So as far as introductions go, you should regard this project as a introduction to research, especially for those of you who this is the first time. I'm getting a little feedback. Hopefully you guys can hear me. Oops. Okay. Okay, good. All right. So Nicholas has given me some good real-time feedback to make sure you guys are hearing me uninterrupted. I guess I could turn my video on. Okay, I guess you guys can see. Okay. So again, quickly, introduction. So we should regard this research as a preliminary project. So in that sense, you guys already have your Cobb collection number. You have kind of that sketch as far as information concerns with that person. And you guys are still completing your CITIs. And so I'm gonna pause there because we really need to focus on, or emphasize rather, the importance of completing your CITI, because we really cannot move forward until that is done. So make sure you finish that, and you can go to the website, cobbresearchlab.com, and look at the SMDEP specified instructions to make sure you complete that information, and make sure you title it, the subject line and your document properly, so when we're searching through our emails, we can actually locate your file. Because I think we've been getting some feedback from folks that they've sent things, but we can't find them. And that's because they need to be named appropriately in the subject line, as well as the document in and of itself. And so on my list, so that's right, the confidentiality, CITI, and I think the next time we can just jump into the biohistories. So I'm gonna share my screen over here. I think I can do that. Yeah. So yes, we're gonna go. We're gonna do. Paper outline. Yes. So going over this in detail, right? So you guys got these outlines already. They pretty much chart out exactly what we are looking for. So background, societal depiction. So think about, your world history class, your cultural nuance class. We really want you to get into the mind frame of the environment. What was going on then? Because that largely helps shape contextually their disease onset and how they lived. And as you start thinking about how did this person get to become into the Cobb collection? How did this person have this cause of death. What was going on during that time that could help influence their disease onset, and in more cases than not, an untimely death. And so that's when we're talking about with background. So try to shape and articulate the environment. And so we kind of broke it down in these 3 subcategories. So how you can start looking at that from like global events. So a lot of this was during, Reconstruction time. The collection was curated between 1932 and 1969. So we know there's a lot of a few wars that are going on then. Reconstruction period, migration from African Americans from the South largely to DC. You still have Jim Crow laws in place, and so you start looking at it, with those types of lenses. And then you got national landscape. So again, like major issues, legislation issues that may have actually affected what was going on. City local issues. So now we're kind of nailing down the local environment. What's happening real time that could also have potentially larger influences. So then we go to the next section, evaluation of the clinical records. So that's what you guys, I guess majority of you already have at this point, the records that have been released to you for your particular individual. And so again, you should regard this outline as exactly what we're looking for, but you can go beyond this and include things that you find that are factual, that could help really develop your story. So under the evaluation of clinical records, look at everything that's there. Their age, their gender, again, place of death, cause of death is what we've looked at here and kind of unpacked a bit. So under place of death, talk about why the individual died at that location. And when you do the background, that can help you talk about that a bit more. So then hospital care specialty, because say, think about modern day, if someone passed away at a nursing home, there's certain things that go on at nursing homes, right? If someone passed away actually at a hospital, there's another set of issues that happen at that location versus someone, dying at home or dying somewhere else. So in our records, you'll see like Freedman's Hospital or Gallinger's Hospital or St. Elizabeth's Hospital. And those all have particular specialties as far as areas of treatment that they focused on. And so when you look at those different places of death, they'll give you even more insight as to what was going on. So what was the likelihood of them being at this facility longer than shorter? And so we can start to help you out with that because we've got more and more information over the last couple of years about these different locations. So actually, I'm going to make a note because I think we have, a document drafted about the different hospitals and places of death that perhaps we can send out to you guys. So again, when you're looking at this, kind of have this lens on, we'll go on to cause of death. So how do you start to think about, cause of death? You can kind of put a forensic hat on, so to speak, and kind of backtrack, what's going on. So again, why the individual died from this disease? Why were, Black men leaving South Carolina to come to DC and then dying of syphilis? What was going on there? And then when from that local to national to global level, it informs why this is happening or has happened. And being a person of, African descent and African American in particular, in a modern sense, you can kind of start to get into that mindset as to, why did this person not seek care sooner than later? What may have been going on then? Um, why do modern day African Americans still have poor seeking health behaviors? Think about those things. And so when you start to think about that, it helps inform the way you contextualize and articulate uh, your studies and your work. So we'll go on to number 3, comparison of all previous findings to modern day. So again, that starts to talk about and hit on what I was just mentioning. How has the societal landscape changed or shifted? Is this comparable or is this comparable to a place of death? Is there a comparable place of death, excuse me, to when they died then to how they died, or how people tend to die now? Are they still dying from the same disease? Are people still dying from syphilis? We know that that's not occurring largely due to the Tuskegee experiment and the treatment being available. So is treatment available now for a disease that the person you've been assigned died from? And if that treatment was available then, why did they not get that treatment? And it could be multiple reasons. It could be, socioeconomic reasons. It could be legislation reasons, but it would be good to find that out because they're going to be aware, right? People want to live. They want to be well. They want to address what these issues were. So why didn't they? What barriers were present that are preventing them from getting that care? Start thinking about things in that sense. So number 4, a conclusive story of the individual's life. Exactly. Start to tie it all together. Start to tie it all together. And again, references. So if you're finding, especially as it relates to your background, that's where you can really bolster your references. As you're describing the environment, things are going on during that time, you can find a poem that encapsulates exactly what was going on, as you believe it was for your person. You can reference, anything that's published to help craft and bolster your story. Think about references as assisting you in telling your story to validate your results and your conclusions and your observations. So think about it from that standpoint. So when you start to work your project in that way, you're starting to understand how to actually conduct research in a responsible way. And that's ultimately what we want to tell you guys, and what we want you to leave with is a better understanding of what research is and how to do it in the best way possible. So you can even think about this as a learning experience and extracting these best practices as it relates to how to actually conduct research. That's what we want to hope that you guys are getting. If you have questions about anything like that, please post them. I'm going to transition to the Cobb Research Lab website. And I'm going to pull up an example of one of the completed reports that we're asking you guys to finish. Perfect. So when you're looking at this, you probably hopefully followed me how I access this. Go to cobresearchlab.com, click on the backbone, click issue 2, and then scroll down, and you'll see all of these different titled articles that have been completed through various researchers and been vetted through the Cobb Lab staff as far as quality and thoroughness. So let's click on, we'll do CC18. So as you can see, this was completed by Theodore, Department of Biology, Howard University, and Jermaine, Department of English at UC Berkeley. So you can see here with the journal. Look at this. Okay. I think we have a question from someone. Someone's telling me you have a question. I don't see it on the screen. Let's see what's going on. Okay. Oh, Aisha. So I'm going to answer Aisha's question. I wish you guys, you know what, I'm going to do this as well. We'll go here and we'll go to document so you guys can see what's going on. Question from Aisha. Hi. In my records, this individual has multiple. How do I have that? Like, so I'm going to type my answer to you on here. So that's a great question because people died and they do still die from complex issues, and especially with African Americans. And so that is classified as comorbidities. So I'm going to put that in a written form on here. Let's see, to this. Use language such as like comorbidities. That's like a really good Googleable term, which is really good. And so when you talk about that, you start to unpack what that is. And so I love doing things real time. So let's go on over those here. So you want simultaneous presence of two chronic diseases or conditions in a patient. So when you Google it, it starts to kind of give you a little more information and language on how to address individuals that have multiple causes of death. Because typically there could be a succession or onset of diseases that kind of develop over time. So someone could have, let's say, arteriosclerosis and cardiovascular disease. And so that could be kind of the same thing, and that could be very linked. And so when they list things multiple at a time is what they're finding at the cause of death. And so to be clear, when you're looking at a lot of these causes of death, you're looking at a post-mortem assessment. So they could find like evidence of multiple diseases post-mortem, so in their cadaver state. So you also can think about maybe what has happened before. Is this was arteriosclerosis the actual cause of death? Or was it actually a heart attack that then resulted from arteriosclerosis? So think about it in that sense. So you should Google exactly what those different diagnoses are or were, and you can start to make sense of the cause of death better. So I hope that answered your question a bit. Okay. So going back to this, to unpack a bit better what we're looking for your biohistories, you can come here and look at the story of CC18. The name has been redacted, keeping in line with confidentiality and being responsible and conducting research. That's the proper way to post this information. So you can see here and how this is kind of broken down in this paragraph form. And it pretty much lines up with what we've already stated in the outline. So if you look in the beginning, they're talking about where this person was born, approximately in that year. It can be speculated that this is likely where both their parents were born, because the records and things of that nature were somewhat available, more or less. So you can start to create this story. And it's great that they use words like speculated, right? Approximately. So these are words that are key to let us know you've done your research, but from the research that's available, there isn't that much information. So you're doing your best guess. And that's where it's very important to document and use language that reflects that. And then you've got some real hard facts in there, right? We've got, the citations from the authors. You've got, the Great Migration, things that are referenced. You see how this is there's more heavy references in the background I was talking about before. So that's what we're looking for. And you can kind of give a good snapshot in that first one. So this person died at a young age in Gallinger Municipal Hospital due to syphilis infection, right? So this tells you a lot. They're born 1903, died 1932, not quite 30 years old. Okay? So these types of things start to come out. And they found out his occupation. So that's another big thing when you are looking at the outline or sketch of information on your individual, look at their occupation, because that would be very insightful to help potentially link their cause of death and understand their lifestyle, which is very important. And then you could talk about the disease in and of itself. So what is syphilis, right? A lot of good information characterizing what the disease is. You know, how many stages of it, you know, make it make sense. They talk about if infection isn't treated, right? Because this is most likely what's happened to this individual, what's going on. And they talk about, so they chose to talk about the disease as a more so staple topic and build around that. So they talked about syphilis and used that as a anchor, if you will, to talk about what's going on during that time. And then factoring in the Cobb Lab individual and how he fit into this sort of epidemic that was occurring. So that's the approach that this paper is kind of taking on, which is fine, you know, because it helps unpack their story as it relates to disease. See, this is great. This is good information. Mm-hmm. And I like this last paragraph because it starts to kind of round it out. And it doesn't have to, you guys don't have to follow this one word for word. You know, of course, just style-wise can be open. So if you're listening in the beginning, you can see there's multiple ways how you can craft your story. You can have a disease focus and how your person fits into that. You can have a first person kind of focus, you know, what's going on from this individual's perspective as much as possible. How can you talk about that? All of these are valid approaches, but you have to make your story make sense and have, you know, proper references. So let's briefly touch on one of the other ones that were published, see if it, how different. So this one's by Rachel from the Florida Gulf Coast University, and Mariela from the University of Puerto Rico. And you can see how they did theirs. So this is also a part of your research, right? Doing your background on your project to look at the expectations that we have for your research. So you can, you know, look at this and get a good idea. So understanding society, era, economy, political status of the people at the time is an essential part of understanding someone's history. Just excellent. We like that. So, we talk about resources, right? This is great. Research like this allows us to profoundly understand physiological, mental, economic, cultural, and geographic details that affect a specific individual and complete society. So this is perfect. This rounds out exactly the type of research that we're doing and the type of research you are completing by enlisting to finish this research with us. So Ancestry.com, right, is the website that's sort of the primary source for a lot of recollection from the National Archives and the 1920s census records. So when you're looking at Ancestry.com, that's where you can input that individual's name, see what comes up, and start weaving together your story for this individual. So again, there's multiple approaches to complete your work. So when you're working with your group member, decide on a game plan, okay? Game plan on how you want to approach this. And actually, Dr. Jackson wanted me to tell you guys, so let's see, Dr. Jackson, she says, please complete submit a outline by June 26th. Okay. So she wants you guys to complete a draft outline. So think about the outline that we generated for you, and you can build into there. You could say under background, you could talk about, Jim Crow era, Reconstruction, and how you're going to break down characterizing that environment. And then in another bullet, you can have, cause of death. And then the sub bullets, you can say, syphilis, primary stages, expected stage at time of death. You can then go into, current events, current treatment, outline out how you're going to do that. So if you give us those outlines, then it becomes even more easier, and we can help where we can. So hopefully you guys see that, and we'll expect that. That'll be actually the next 4 or 5 days or so. So that'll really help you guys start to think about how to approach this. And so Nicholas sent me something about the scientific method and how this project fits in that scheme, even though it's not bench work. So it doesn't, the project you guys are doing is hands-on in the way that you are piecing together this individual's story. It's a very kind of forensic social science approach, which is a great way to be introduced to research. Because as you get into more hands-on, when you think about biology or anatomy or genetics or molecular biology, engineering, a lot of these projects are shaped around social issues. So if you can contextualize and understand the nature of your project, you're going to be light years ahead. And that's what this project's all about, is how you can start thinking as a scientist, start thinking, as someone who's been in the field for years and decades. Because in order to do this, you have to be very meticulous, very detail-oriented, and document your work. Nicholas said something about hypothesis. That's not necessarily appropriate for this research, in that you aren't assuming really anything in particular, because hypotheses are around posing ideas or questions that you think post an experiment will then prove. So in that sense, we're not conducting an experiment, right? So you're conducting research in a more retroactive way to then put on the lens of cultural relevance. So in that sense, there's no experiment that you're performing. So the understanding of implementing the scientific method kind of stops there. So if we were doing the hands-on, so a lot of the other work, so you can go to the website, back to Cobb Research Lab here, and if you look at our research tab, These are the fields of research that we are focusing on in the lab. In order to do that, we've got to do real-time, hands-on research. So comparative anatomy, right? So that's one of our, another kind of introductory way to then do hypotheses-oriented scientific methodology work, where you've got an individual who died from syphilis, and you have, another person who hasn't, and making sure that they're comparable as far as age, environment, and your question could be, I think, or we think that syphilis primarily affected, African American males more than European males, and that would be like your question, and it'll be more specific when you put more limitations on it, right, and your assumptions. And so you could take the research that we're doing and make it an experiment as far as finding some data that may already exist. And if you find that, if you guys are more interested in doing that, we can talk more about that. And then you can compare potentially already existing data sets to then find really new information kind of based on this intellectual curiosity. And so we can talk about that even more if that's something you guys want to do. I know we're nearing the 7 o'clock. If anybody has any more questions, please post or send the email so I can try to answer those before you guys go to your mandatory study hall. I don't see anything posted, and Nicholas hasn't sent me another message, but I hope that this was helpful. I hope that if you guys have any other questions, please feel free to email them to us. I will be in the lab tomorrow and Thursday, and again next week, Tuesday, Wednesday, Thursday, and available to answer you all's emails. I apologize for missing your coordination last week, but I will be readily replying and reaching out to you guys for things that you need. But I think for the most part, everything is laid out, on the website as far as dates and expectations. And I think, Nicholas, if you can add on there, I may add on there the outline expectation. That will also be really key for you guys. So the main thing for you to do is complete your CITIs, right? Make sure you name it appropriately. Email it to us. We've completed the video conference call for today. And then we're gonna say, what was that, the June 26th time to complete your draft outline. And then the next date, your rough draft by July 1st, and then your final draft. And so we've given you points of reference. We've given you access to the Ancestry.com. And that's pretty much everything. So again, if you guys have questions, feel free to email, let us know. And we're really excited about working with you guys. So looking forward to it. All right, we're gonna sign off. So enjoy your guys' study hall. All right, bye.